coming to the next batch of vaccine, that is pentavalent vaccine, MR and vitamin A. Last class was on birth vaccines. These vaccines are not given at birth. Why not? Because at the very first of all, these diseases are not that much prevalent in the early stage of the life of the baby, except being pentavalent, because that pentavalent contains hepatitis B. Okay, later I will come to it. First, coming to the first, what is the pentavalent vaccine? It is being introduced in 2016 in Mission Indradhanush. What is the pentavalent vaccine? It usually protects against 5 diseases: diphtheria, pertussis, tetanus, hepatitis B and Hemophilus Influenza B. We all know that diphtheria, pertussis and tetanus, it is previously we give the vaccine as DPT. Now it is being replaced. Hepatitis B is given at birth dose, and then hepatitis B booster was given at 6, 10 and 14 weeks. The birth dose is remained the same, but booster on 6, 10 and 14 is included in the pentavalent vaccine. And Hemophilus Influenza B, why it is being added, I will come to it later. Okay. First bench. Last time I have described how to describe a vaccine vial. Say like that. Suppose in examiner has given you this. How will you describe? Now coming to the first DPT vaccine. Now DPT vaccine is not used, but you should remember the epidemiology, because in 2016 there was still diphtheria case around 2600. In 17 suddenly it got increased, it got 5000, a sudden increase. The reason is still not known. Okay, Pertussis cases has decreased regarding in the years, and tetanus case has been seriously decreased. This tetanus actually overall for neonatal tetanus it is 588 cases in 2012 and then 295 cases with 9 deaths in 2017. Why do you think neonatal tetanus case has been decreased? Before 2009 or 8, neonatal death of, I think this time one question, neonatal mortality rate came now in final, it's senior batch. That cause actually right now it is low birth weight. Previously that it was acute respiratory distress or respiratory infection. Before that it was neonatal tetanus. When we introduced maternal immunization, the second cause became first. Then what we introduced? Now one important program, SARS. Okay. So it is now low birth weight. We are strengthening our ICDS system. If every mother got the correct nutrition, the low birth weight rate will be also the secondary causes, and primary cause will be a very insignificant thing. That was trauma. Okay, not birth trauma, asphyxia. Some physical trauma. It was also a cause, very secondary cause, but it will be the first. That's how after introducing new programs and strategies, we are actually omitting modifiable cause. These all are being modified. Tetanus, neonatal tetanus was a modifiable factor for neonatal death. Same goes by respiratory distress also. Okay. Now what is the component of the DPT vaccine? What is tetanus toxoid? These units you should not remember. Just try to remember as a ratio. Okay. If it is 20, then it is 5, and what the pertussis usually previously it contains killed whole cell pertussis, but now acellular component is being given because of adverse events. Killed whole cell pertussis bacilli vaccines usually causes more adverse event, but acellular pertussis cause no adverse event at all. And what is the adsorbent? Adsorbent, it is insoluble aluminum salt which acts as adjuvant. This is the important point, usually comes in the MCQ. What is the efficacy? Efficacy against diphtheria and tetanus exceeds 95%. Efficacy of whole cell pertussis vaccine against pertussis in children is 78. The efficacy of combination ranged from 46 to 92%. So, why it is being combined? Because the single thing is 95, the single WP is 78, but the combination is effective is 46, very low score. Any person get 46 and 92. Any idea why it is being still it is being combined? There is a chance of less efficacy. Actually, সমস্ত vaccine গুলো, these vaccines will be given at the same time. All things are injectable. A child should not be injected that much, na. The sites we will not have more sites. So that's why it is being combined. At least okay. It is low, but it is still not that much low. The adverse effect AEFI regarding DPT is very important. Okay, it is asked many times. It is a very important short note also. So, what is the serious adverse effects? Fever, persisting crying, hypotonic hyporesponsive episode, HHEs. In AEFI, there is a list in the park. Okay, AFP and HHE. What is when it is AFP, acute flaccid paralysis? That's definition, and HHE is definition. You should remember. And it's a very rare thing is encephalopathy. Okay, sometimes the child shows seizures also. What are the minor adverse effects? Pain, swelling, redness at the local site, fever, fussiness, anorexia and vomiting are reported almost half the vaccine is after any of the 3 primary doses. It is given 3 times, na, previously 6, 10 and 14. And again, why I still maintain the DPT? Because we got DPT booster at 5 to 6 hours of age, 5 to 6 years of age. Okay, this is DPT vaccine. What are the contraindication? Obviously anaphylaxis and development of encephalopathy within 7 days of giving previous DTWP, or any relative contraindication, progressive or evolving any neurological illness. Look, that vial is for adolescent and adult. Okay, that thing is different. This is for children. The dose is not important now because it is being replaced. But remember only the catch-up vaccination. If a child you do not know came to your OPD, okay, the child should be less than 7 years of age. Okay, remember. So, what will be the dose? You will give at 0, 1 and 6 months, irrespective of the age. Okay. Obviously, the child will come after 6. You can determine what are the child's age, at least more than 6 weeks or not. And then, okay, cold chain, it will not important. TTAP, it is not. Just remember, in DTAP, the febrile hemagglutinin 1, 2, 3 has been added. Okay, just remember only that last line. Now coming to the why Hemophilus influenzae has been added and the pentavalent vaccine is being generated. I think first, the Hemophilus influenzae is a bacteria first described in 1892. What it has 6 serotypes A to F. Type B is most invasive infection. What is called? It is type B usually causes meningitis. It can cause otitis media, phagocytis, epiglottitis, tracheobronchitis, bacteremia for severe immunocompetent and pneumonia. All things usually it mainly affects our respiratory system and meningitis. Okay. The Hemophilus influenzae bacteria usually live in the nose and throat area like measles. Hemophilus influenzae bacteria are passed from child to child in air droplets when infected child coughs or sneezes. But remember, not all, some became carrier. Okay. Here is the picture, red one is the carrier. Okay. That child is not diseased, he is carrier. Carrier will show no symptom. That's why he is mixed among another other childs. Blue one uninfected. Then what happened? Carrier actually can create three type of result. Another carrier like him, that's one red. One show the disease, that is infected yellow. And again some people are immunized from the birth. This is some genetic thing. Okay. One carrier can create three type of things, and one carrier and one infected, they can also create three. Okay. This is propagative transmission. You will disease infectious disease epidemiology হয়ে গেছে ইয়েতে থিওরিতে, in theory infectious disease epidemiology. Okay. Just a figure that estimated 72,000 deaths due to pneumonia and meningitis per year in India. I told you previously, some year ago even when I studied UG, Hemophilus influenzae infection was the leading cause of neonatal mortality. This thing is not needed now, just read after getting the PPT if you want. Who are at most risk of disease? The children between 4 months to 18 months of age are more at risk. Okay. Children often carry HIV bacteria without showing any signs or symptoms, but they still can infect others, just like the previous picture. And like measles, HIV bacteria pass from child to child in airdrop when an infected child coughs or sneezes. Remember the highlighted line mainly causes disease among children under 1 year of age. After 1 year, it is not that much. I think this is when I made the slide. I didn't thought about the size. Okay. I am reading the lines. Okay. Hemophilus influenzae vaccine is highly safe and effective. 3 doses of HIV immunization reduces the risk of HIV disease by more than 90%, which are mainly pneumonia and meningitis. Obviously, meningitis and pneumonia both can be fatal. So, if 90% of these are prevented, then we are okay with that. We are not bothering about whether tonsillitis or otitis media is there or not. HIV vaccine does not protect against disease caused by other germs. Obviously, vaccine is specific. Even after full HIV immunization, a child may still get other types of pneumonia, meningitis or viral infection such as the flu. Obviously, there are many bacteria right now, many types of viral infection it can causes. Okay, just remember what is the vial comes with 5 ml, 10 dose vial. So what is the dose? Dose 0.5. Open vial policy is also applicable. Maximum wastage permissible is 15%. Wastage factor I will tell you when I will teach you cold chain. And it is also a fridge sensitive. I told that T series vaccines are all fridge sensitive. So here everyone is T series. So what is the storage temperature? +2 to +8 degrees Celsius in the basket in ice-lined refrigerator. What are the schedule now? Previously it was at 6, 10 and 14 weeks we were supposed to give an OPV1, DPT1 and hepatitis B1, and 2 and 3 at 10 weeks and 14 weeks. It is replaced now OPV1 and pentavalent 1, OPV2 and pentavalent 2 OPV3 and IPV is being given in 14 weeks, you know. The DPT booster is 16 to 24 months, okay, and at 5 to 6 years DPT booster second dose. There is one catch, that what is the site of the DPT booster, okay, I will come to it later. This is also one thing you should know. After combining, the price has actually increased, but still we are giving pentavalent. Just remember the highlight thing, minor illness such as upper respiratory tract infection are not a contraindication to vaccination. Okay, this thing usually being asked in routine immunization session, even in the obviously in MCQs also. This is usually not asked. You know that যদি কোনো বাচ্চা হচ্ছে গিয়ে অ্যাটলিস্ট 1 ডোজ পেন্টাভ্যালেন্ট তার ফার্স্ট বার্থডের আগে পেয়েছে, তারপর আর পায়নি, ওকে, চাইল্ড দেয়ার আর মিস ডোজ, সো হোয়াট টু ডু? So what we will do, after at least 1 dose is given, we will give the second dose, and 4 weeks later we will give the third dose also. Okay. Can pentavalent vaccine be given with other vaccines? Pentavalent vaccine can safely be given along with other vaccines such as polio, BCG and measles during the same immunization visit. Usually this happens if there is a missed dose, a child of missed dose, missed dose আছে তাদের ক্ষেত্রে, তো BCG নেয়নি, 6 weeks এর মাথায় আসছে, ওকে, অথবা কোনো সেকেন্ড বা থার্ড ডোজ মিস হয়েছে, 9 months এ ডাইরেক্ট আসছে, ফার্স্ট ডোজ নিয়েছে পেন্টাভ্যালেন্ট, তারপর হচ্ছে গিয়ে 9 months এ ডাইরেক্ট এসছে, কি করবে তখন? দেওয়া যায় কি? হ্যাঁ দেওয়া যায়। ভিভিএম নেই না, কেন নেই জানো? MR ভ্যাকসিন usually if examiner asked where is the VVM, tell me the VVM status, should say that VVM, yes, VVM in MR vaccine is in the top. Why in the top? The কালারটা কিছু একটা ইন্ডিকেট করে, হ্যাঁ, অ্যাম্বার কালার। কেন অ্যাম্বার কালার? Why it is amber color? সানলাইট। তাহলে সাপোজ ভ্যাকসিন গুলো রাখা আছে একটা, you should see the vaccine carrier box na, you have seen the pictures, at least in park there is the picture, vaccine cold carrier box, the vaccines are kept there. If the VVM is in the side, one should have to take out and then see. It is amber colored, but still it is being exposed to sunlight. So why? If the VVM is in the top, he will just see, okay, bring out that vial, discard that vial. No need to pull it up, na? That's why VVM is in the top. And there are VVM types also. Can anyone say what is the type of VVM in the OPV? Number, that is VVM, it is number, not stage, number. Okay, I will teach you in cold chain, okay, or remember me later, I will give you the picture. VVM 2, okay, type 2 is in OPV. Okay, coming so next is one Measles-Rubella disease, okay. Previously it was mumps, measles and rubella. Why mumps got why mumps got omitted or discontinued? Because mumps is not that much fatal, okay. It is, if you read the mumps, there is very one rare but very bad adverse effect of not adverse effect, is complication of mumps, okay. You should read in the park, it is not good for some people. Coming to the measles, it's a highly infectious disease. causing illness and death due to complication and form of diarrhea, pneumonia. What is rubella? It is a mild yet highly contagious disease that can cause crippling birth defects or the even death of the unborn child of an infected pregnant woman. Here the one short note usually come in paid also, that is what is congenital rubella syndrome. What is that? It is a set of serious congenital defect a child may be born when a pregnant woman gets rubella infection in her early pregnancy, usually in the first trimester. Okay, this question comes once in INI-CET. Before INI-CET there was AIMS, actually AIMS. In the early pregnancy, that word is important. First trimester baby will get congenital rubella syndrome, not if the mother gets contracted in the last or second trimester. Okay. What are the manifestations of congenital rubella syndrome? There is blindness, deafness, heart defect, mental retardation and liver disorder. There was a special type of heart defect, I actually do not remember now. You should read in the Ghai or Meherban Singh. Okay. Even Nelson it is given. Why is measles rubella vaccine given? MR vaccine given for preventing both, to eliminate the measles and controlling rubella. Does it keep the lifelong protection? Yes, MR vaccine gives lifelong protection in most of the children, and 2 doses of MR vaccine protects the child from both disease, but it is not correct. Okay. You may get measles in your adolescent. Okay. This is current research. And do you remember what is the one complication of measles? What is that? Fatal. So it is in micro. Fatal. What's the full form? Subacute sclerosing pan. ফুল গোটা এনসেফালোগ্রাফ যা আছে গোটাটাই ইনফেক্টেড হয়ে যাবে, দ্যাট ইজ এসএসপি। Does a combined vaccine? No, efficacy of both vaccine remains the same. It is very different from the pentavalent or DPT. Any side effect? No. Usually measles, it is a live vaccine and comes as like BCG. It comes as freeze dried powder from here. Okay. A diluent is given, the diluent that is ampule. Okay. The diluent that is ampule. This is vial. How much diluent will be used to reconstitute the MR vaccine? Okay, the full quantity. What is the component of the diluent? Usually sterile water. Okay, or sometimes it differs from company, the manufacturer to manufacturer. Okay, some manufacturer added some extra salt or element to make the viability longer. Okay, and it like pentavalent, this is also for 10 dose. And who should not be vaccinated? Do not vaccinate if the child has high fever or other serious disease, or hospitalized children and history of a severe allergic reaction to measles and rubella vaccine in the past. So why এটা হচ্ছে গিয়ে কেন, why it is being given this much late in their life, not why it is not being included in the birth dose? Because measles, and especially measles, there is a measles antibody, usually it is the maternal antibodies are still present. Okay, those are enough to prevent the disease. That's why it is not given. And why MR and not MMR? Read only the red highlighted portion. There are no enough evidence to suggest that mumps is a disease of public health importance. Okay, PHEIC. That I think this year came international health regulation. Also there was one term, PHEIC, public health emergency of international concern. Okay, if that it may come also as a short note. And what you will write? again the IHR, just in a twisted way. And what is the public health important? When any disease gets epidemic, then it is public health important. Endemic, epidemic, pandemic definition, I think you should know. Is being covered in the theory classes or not? বলেছিল স্যার, তাই তো? ব্যাস মনে রেখো। And if some questions, if a child come late for the first dose, then can it get the second dose of the measles vaccine? The first dose should be given in the completed 9 months to 12 months of age and second dose as 16 to 24. One word remember, okay, the dose of first MR vaccine is completed 9th month, not as 9 month, completed 9 month. That means after completion of the whole 9th month, then the child will be eligible. Okay, this is a trick question. And usually when you calculate the next vaccination date, many do errors, okay. And however, if the child comes late, then give the 2 doses of measles vaccine at 1 month of interval, if the child is less than 5 years of age. Why give the measles vaccines only on the right upper arm? The side dose I have made a table, it is in the last, okay, that is why I am not telling those things. These FAQs are I am covering first, because these are explained why, and these have come usually in the MCQ. To maintain the uniformity, right upper arm, because in left upper arm, which live vaccine has been given? BCG. In 2022, there was a catch up MR campaign, okay. There it was decided to see the scar, like same BCG scar, that MR scar. So if it was on the again left hand, we were confused whether it is a MR scar or BCG scar in a child. That is why it was decided on the right side, okay. And coming to the last vaccine of the day, it is not vaccine, it is supplement. What is supplement? Supplement কখন দিতে হয়? তো জিম টিম করিস প্রোটিন সাপ্লিমেন্ট, why supplement? ডেফিসিয়েন্সি এক্সট্রা, তাই তো, নিজের প্রয়োজন মেটানোর জন্য। এটা এর মধ্যেই যেন থাকে, বার করলে নিজের হাতেই লাগবে। এক্সট্রা ভিটামিন এ মনে হয় না কারো দরকার আছে, তাই না? এটা এর মধ্যেই এরকম করেই নাও, ছবিগুলো তুলে দিও, দেখো। The vitamin A dose, সবাই at least you all know, the first dose at 9 months, 1 lakh unit. Each subsequent dose is given at the 6-month interval, subsequent dose 2 lakh up until age 5 years. What is the total dose? যদি হিসাব করা হয়, I think 17 lakh units. No? It is given orally. What is the formulation? These things usually ask. It is a syrup. Composition, what are the composition? Retinol palmitate equivalent to 1 lakh international unit of vitamin A per ml, dissolved in groundnut or arachis oil base. Administered with spoon specially designated to measure 1 or 2 ml of syrup. It is also still storage in amber colored bottle, it kept in room temperature away from sunlight. Okay, if the person has groundnut or arachis allergy, okay, if it cause anaphylaxis, then what is given? Usually there are some specialized salt, okay, vitamin A fortified salt is given, or that ছেড়ে দিতে হবে, কিছু করার নেই। ওকে আর ভিটামিন এ দেওয়া যাবে না, ও যখন বড় হবে তখন ঠুসিয়ে অন্য সোর্স দেওয়া যাবে, বাট ভিটামিন এ দেওয়া যাবে না। This is vitamin A supplementation for routine immunization, okay. What are the prophylaxis and what are the treatment of vitamin A deficiency with this syrup? It is written in the park, okay, read that very much carefully. And if there is now coming to the today's, that what are the thing, okay, pentavalent, that Due age is 6, 10 and 14 weeks. Maximum age it can be given 1 year. Dose 0.5 root IM. If there is any diluent, no. And what are the site? Left side, anterolateral medial side of thigh of left side. Okay. MR, it is given subcutaneous, 9 completed months, first dose, and up until 12 months. And what is the second dose? I have not written. MR second dose, it covered in the. And what is the route? Subcutaneous, diluent, manufacturer supplied, usually sterile water, side upper arm, right side. Vitamin A, it is again 9 months, then up to 5 years. And first dose, তুই কখন দিতে পারবে? Up until 5 years অবধি 1 lakh, এবং তারপর হচ্ছে কি 1 মাসের মধ্যেই সেকেন্ড ডোজ হচ্ছে কি আবার 2 লাখ করে দিয়ে দিতে হবে। Then you can skip 6 months interval. If a child comes that no vitamin has been given, more than 1 year, okay, at least more than 9 months, whatever the age, you will give 1 lakh unit instant. Then after 1 month, 2 lakh units. Then you can still give 2 lakh units every 6 months up until 5 years of age. Now coming to the DPT booster, first given in the 16 to 24 months, that's also maximum 7 years. What is the dose? 0.5 ml, root IM, no diluent, site, anterolateral medial side of thigh, left side. But in DPT booster 2, it is asked, okay, multiple times,